Some cancers are very treatable. Testicular cancer is one of them, but I'm willing to bet most men are not checking for it like they should be. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Testicular cancer impacts mostly younger men. The average age of diagnosis is just 33 years of age, according to the American Cancer Society, and more than 95% of men who get it survive it. Today, we'll ask what makes it so survivable and hear what treatment is like. But first, let's hear from one survivor with a simple message. Talk about it.
I'm willing to talk about my testicles because that helps one other guy, and then put your pride to the side and just try to help someone.
31-year-old reporter Tom Dempsey covers some tough stories.
Investigators are saying it was that severe weather right on Table Rock Lake that you see behind me that caused this tragedy.
But it's this part of his own story that has proven to be his toughest yet.
It was kind of weird for me to be like, I'm having some discomfort down there. It was weird for me to talk about.
So he had them checked out.
You're getting an ultrasound on your testicles, and all I could think about was telling my mom and my dad, telling Nicole, like, that I might have cancer.
There was never in a million years we thought that's what it was.
Tom was referred to urologist Dr. Jeff Holzberlein at the University of Kansas Cancer Center.
A testicular mass is always very concerning in that age group.
Dr. Holzberlein says young men and parents need to know the signs and symptoms.
Back pain that's not ordinary. Nipple tenderness, particularly after puberty, could be a sign of testicular cancer. Pain in the testicle.
Tom's treatment was to remove his testicle and replace it with a prosthesis. Dr. Holzberlein says it can be similar to the same feeling a woman goes through after a mastectomy.
There's some reverse discrimination. I think men think their testicles are just as important as women think of their breasts.
Right there. Oh, man.
Nicole created Tom's Army to help support Tom through his fight.
That's cool. Tom's Army.
And friends, family members, co-workers, strangers from across the country. I mean, the Testicular Cancer Society founder reaching out to me.
And all that support has inspired Tom to help break down the stigmas and let men know it's okay to talk about concerns down there.
And I think there's just this weird thing with men that if you're having some sort of discomfort down there, like you're not allowed to have issues with your testicles. I think it's like makes you less of a man if you have one testicle, and that's ridiculous. I think the bigger man is the guy who decides to go into the hospital, and I'm going to do something about this.
Absolutely. Very important message. And we are joined now by two doctors and experts in testicular cancer. You just heard from in that story, Dr. Jeff Holzberlein specializes in urologic cancers. He is also the physician-in-chief at the University of Kansas Cancer Center. Good to see you as always. We're also happy to have Dr. Elizabeth Wolf-Birchfield, a medical oncologist specializing in genital and urinary cancers. So glad to have both of you here to talk about this really important topic. And Dr. Holzberlein, we spoke with Tom Dempsey before this program. He says he's really doing well, working in D.C. now, and so good to get a good update from him. But what do you remember about him as far as being a patient?
Well, first of all, I remember his bravery. His bravery was pretty outstanding, and he really, listened and took to heart what he needed to do. But I also remember, how scared he was. Getting the diagnosis of cancer is incredibly scary, regardless of what that cancer is and whether it's treatable or not. But he was, just a fantastic trooper, and then has been an amazing advocate.
He sure has. He sure has, and that's really, really important. Dr. Wolf-Birchfield, what do you make of that message? Just being comfortable talking about your testicles.
I mean, it's amazing that in this day and age, with everything that social media has done for advocacy of all sorts, that there still is stigma and there still are taboo topics. I think of, the sort of double standard with those Save the Tatas bumper stickers for breast cancer, and I just love that. Just kind of the idea of using colloquialisms to talk about something so profound. And I love his message because I think without talking about it, people will feel fearful of raising it with their clinicians, the folks who will help them and advocate for them the most. I love his message.
And let's bring in one of your patients, cancer survivor Zach Archer, joining us remotely this morning. Zach, how are you?
Good. How are you, Jessica?
Very good. Thank you for joining us. And again, just being a face of this, because it can happen to anyone. So we appreciate that. You were diagnosed with testicular cancer at age 27. Just talk to us about your story and getting that news and what you thought.
So one night, my wife and I, we were having some adult fun time, and she felt down there and she told me I didn't have much of a choice. I needed to get it in and get checked out. When I did, I got the ultrasound, kind of like what Tom said in his story. When I got the ultrasound, I was felt a little uncomfortable about it, but powered through it. Got to the doctor that recommended me for the ultrasound, and he told me about the tumor that was in it. And then I got transferred over to KU for treatment, had my right testicle removed. And from there, we just went on to removing it, getting in contact with Dr. Wolf Butchfield, which amazing doctor, love her. When treatment started, the very first day, I just remember sitting in one of the chairs in the treatment center, and I couldn't put my feet flat on the floor. And I just looked over at my wife and I told her, I feel like a little kid right now. Went through and had bleomycin, cisplatin, and etoposide, and that very first day ended up getting a shot of Benadryl because the etoposide, I believe, sent me down to where my blood pressure was only 50.
So, Zach, leading up to this diagnosis and having it removed, were you feeling anything? Did it hurt? Looking back, were you having any symptoms at all?
I do remember some pain down in my groin area and a little bit of back pain as it kind of progressed along. And I've been in the military for 12 years. I just chalked out the back pain of not being smart in my early 20s and late teens of jumping down from the big trucks onto the ground flat-footed. But after finding out that the lower back pain could also be for testicular cancer, that's when I was like, oh, maybe I should have gotten in a little bit sooner.
But you got in. And you shared a photo of your final treatment, ringing the bell. We love seeing these photos. What was that moment like for you?
Wholesome. Felt like I was finally done with a huge milestone and I could get on with the rest of my life.
And you mentioned about the awkward feelings you had in the beginning. Looking back now and knowing that you can do what you're doing today, which is talk about it, how does that feel now? And how do you plan on making people feel more comfortable talking about it?
Well, it makes me feel more comfortable for sure. And one of my wife's cousins has actually already reached out to me and asked what he should do about it. And I said, don't be afraid. It's normal when you first start to feel weird about it, and just go in, talk to your doctor, get it checked out, get it taken care of before something worse happens.
Save a life like that. So I want to ask, because the big headline, Dr. Holzberlein, is there really isn't a big headline because testicular cancer is very survivable if caught early. Survivable, you say, at all stages. Talk to us a little bit about that.
And so, testicular cancer is really sort of the poster child for the curable solid tumors. Mm-hmm. The game changer, there's been a number of things that really were game changers. Really, the early 70s is when we started seeing survival rates, which used to be about 50%, go up to over 90%. And so treatments really have advanced, and as we get better and better at curing it, we're also looking at ways to decrease the burden of the treatment, so decrease the toxicity that goes along with it. But yes, early diagnosis to perhaps avoid chemotherapy if possible is a great way. But even if it's an advanced stage, highly curable in many instances.
I love how you compare the breast to the testicles. I always remember that line. It was one of the first interviews you and I did, and I came back. I said, I love that guy. He said that because it really made a lot of sense, something we don't think about. But when you said that 50 to 90% jump over those decades, did it have anything to do, though, with people feeling more comfortable talking about it and bringing it to the forefront?
Unfortunately not.
Okay.
And some of my partners, Dr. AJ Nangia, has done a lot of work in this area, and we've really recognized a pretty significant deficit in instruction to young males. Mm-hmm. I think many of us know that health class is not maybe meeting the needs of what we need to be talking to our children about for preventative medicine. Certainly testicular exams are one of those things that's not being taught or told, and so many people really aren't aware, many men aren't aware how to do it.
So your teenage boys are putting their fingers in their ear and saying, no, I don't want to talk about this, mom or dad. So Dr. Wolf Birchfield, you know, are those self-exams, how important are they, and how are we to talk to our kids about them at a young age?
Yeah, they are important. I mean, we think that, I think because of this kind of ongoing stigma and taboo, it is still a little bit hard to have the data about it. But I think that not only are the exams themselves important, but just having the conversation about bodies and about how to access medical care that goes along with those sorts of conversations. It's really, the exam is important, but it really kind of opens the door to so much that parents and loved ones can do to help create a sense of security with folks, healthcare providers, and speaking up with them as well.
Yeah, and just owning your own body.
Yeah.
And then being able to, you do these exams on yourself, but then you got to talk about them.
Yes.
All right. How do you do them, and what are you looking for?
Yeah, so you know, we oftentimes actually mirror what women are taught, and that is that probably in a warm shower is the best place when the scrotum's relaxed. And they just want to feel for the testicle. They want to make sure they're feeling the actual testicle and not the tube off the back of the testicle, which is called the epididymis. Sometimes, you know, that can be a little bit difficult to tell the difference. And so again, if you're not sure, then seek the attention of your physician. Your primary physician or pediatrician can help instruct you in terms of how to do a testicular exam.
So how common is it to have to, Dr. Wolf Birchfield, to have a testicle removed? We know that happened with Zach.
Yeah, great question. So it's essentially it's almost a 100% rate at if someone is diagnosed with testis cancer, although we know that there are some instances in which patients can have a partial orchiectomy, and that's not the standard of care for most patients. There is research going on in that vein as well, but most men with almost all men with testis cancer have a testicle removed.
So how does that conversation go when you have to tell them that?
You know, truthfully, they actually have usually had that operation before they get to me.
Okay.
And I would defer to Dr. Holzberlein, who has the most experience and wisdom there.
How well does that go? Because I know you are able to bring the option of a prosthesis, but would you have to share that information?
Yeah, I think it's more concerning when they get the diagnosis of cancer. And so, like most patients, when you tell them, I'm going to take the cancer out, they're actually relieved by that. You know, fortunately for some of the organs, paired organs, meaning you have another one, that's the case with most patients with testicular cancer. And so they have an opposite one, and we reassure them that that opposite testicle is adequate for all of the functions that they need, both hormonal function as well as fertility.
So Zach, what was that like as far as the conversation to remove your testicle? How did that go? What were you told?
So I was mainly told that when it was confirmed by my doctor that removed my testicle, that yes, it was cancer. Yes, basically the same thing that doctor just said there. I had another one. Fertility wasn't going to be an issue. Even had the chance to be sure to put some semen away into a frozen section. When it came down to surgery day, though, and I got told that the cancer had spread to my lymph nodes, my wife and I, we just kind of decided, you know, we do have both of our kids. We weren't really worried about freezing semen at the time, and we just wanted to get through this as quick as possible.
Yeah, that makes sense. And you're saying there's not testicular implants are not an option for everyone? Is that true? Or?
They're really an option for everyone. Not everyone is offered a testicular implant. For a while, there was some difficulty getting insurance companies to cover the prosthesis, but I think that that's mostly gone by the wayside, and most patients are eligible for a testicular prosthesis.
So Zach said that fertility wasn't an issue for him, but when it is a question that comes from your patients, I'll start with you, Dr. Wolf Birchfield. What are their options, and what are the concerns that patients have?
Well, this is a conversation with every patient, every time, no exceptions. You know, we want to make sure that people are able to have the family that they want, regardless of their diagnosis and the treatment that they need. So this is something that we would essentially try to hit the pause button and address before starting chemotherapy. So it can essentially involves sperm banking, and in order to allow for procedures like IUI or IVF following treatment. And so a lot of the concerns are financial, to be honest with you. I think, unfortunately, this is usually not something that insurance pays for, so there are some costs, but there are some advocacy organizations that also help at least partially fund storage fees for frozen semen. So that's something that our social workers can help connect them with.
How common is testicular cancer?
So it's not a common cancer at all. It is the most common solid tumor, though, in men between the ages of 18 to 35. So overall, it is not a very common cancer, but in young men, it is the most common solid tumor.
Why so young?
We think that it probably has to do with the rapid growth of the testicle, and that during that period of time when people are going through puberty and right afterwards is probably what leads to that. But we don't exactly know.
So we don't know if you're ever really in the clear. I mean, it's a lifetime, it's something that could affect you at any time of life. It's just earlier in age is more.
Yeah, it's pretty rare to see it after the age of 40. It's one of the few cancers that we grow out of, and the risk really goes down. So although you can get a testicular tumor after the age of 40, it's pretty unusual.
Growing out of cancer, that's good. That's a good thing. Dr. Wolf Birchfield, CDC and NCI data show that testicular cancer rates are slowly going up. Why?
I think we're all scratching our head a little bit about that. There are a couple of cancers that I treat that are increasing in incidence. I don't think that we know yet. I think that there are a lot of really brilliant minds that are looking into that, because certainly we want to do everything we can for cancer prevention for all malignancies.
Any insight on why that uptick?
Yeah, we don't really know. We don't have a lot of great risk factors. The highest risk factor for testicular cancer is an undescended testicle. People have posited that perhaps with more children being born earlier and survival rates for preterm babies with oftentimes have undescended testicles, that might be contributing, but could be environmental factors, could also be some genetic factors.
Also, Dr. Holzerlein, we know that the good survival rates, but is there any room for improvement as far as treatment, or is this just all about education and early detection?
Oh, I think there's always room for advances in treatment, and we continue to look at ways to, as I mentioned earlier, decrease the toxicity of the treatment. One of the although this is a survivable tumor, the treatment burden can be quite high. The advantage is that we're dealing with a young, healthy population, and they get through the treatments quite well. I'm sure Zach would tell you it wasn't a walk in the park. It wasn't a lot of fun to get through it, but we can get them through it. So as we move forward, we're looking at ways that we can decrease the toxicity, but still preserve our survival rates.
And pick it up from there, Dr. Wolf Birchfield, on the types of treatment. Just maybe go more specifically and what those different options might look like.
I'd be happy to. So surgery is usually the first step for most individuals, and although if someone is critically ill with this cancer, then sometimes we do start with chemotherapy. In addition to that, testis cancers, including seminomas and non-seminomas, are highly sensitive to chemotherapy and to radiotherapy, and so both chemotherapy and radiation are often options for most patients. What the research has indicated over the last 20 years or so is that the likelihood of secondary cancers related to the testicular cancer treatment is lower with chemotherapy than with radiation. So we've kind of de-implemented radiation as the first step for a lot of patients. But if folks have cancer that has spread to their lymph nodes, then chemotherapy is often really important. And although surgery can still be used, and if the cancer takes root in other parts of the body, lungs, brain, anywhere that's really not the lymph nodes, then chemotherapy is an essential component. And while for many solid tumors, a cancer that takes root in another organ system usually can't be cured, that is not the case with testis cancer, and we are still expecting cure and working toward that from day one, regardless of whether this has spread to another part of the body even.
Zach, how did you handle treatment? What was it like?
It was rough. It was 3 sessions, 3 weeks. I went every day, and then 2 single days in between those full weeks. I can just remember being at home and my entire body would be I'd wake up at 2 in the morning and my entire body would just be pulsating from the pain of chemotherapy. And it like the doctor said, it was definitely not a walk in the park at all. It was rough.
Well, be sure to ask your questions. You can use the chat on YouTube and Facebook, tweet us, or email us at the Medical News Network. That info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson joins us. Hi.
Yeah, hi. Holding pretty steady on COVID active cases. Right now in the hospital, 38 total, but 20 active, 4 in the ICU and 0 on the ventilator.
So, Doc Hawk, COVID, less of a threat these days thanks to vaccines and drugs, as we know. But viruses, as we know, can mutate. And you make the very good point that we need to be ready just in case, God forbid, the virus mutates and can resist vaccines and drugs. So how do we stop something like that from happening?
Yeah, again, SARS-CoV-2 is less of a threat for most people. We have natural immunity, but also vaccine-induced immunity, and people have been probably infected and reinfected. We also have very good medications to help reduce your chance, especially if you are immunocompromised, reduce your chance of going to the hospital and severe illness. But I was asked this question recently, can we prevent the next pandemic? I think that's a very tall order. What we can do is prepare as well as we can for the next pandemic, but that includes a lot of resources. That includes infrastructure for surveillance, not just here, but obviously around the world. That includes resources to help research and development of new vaccines, but also potential therapeutics as well. So it is multifactorial, but I think what we need to do is work on preparation, especially in surveillance and research, to prepare for the next pandemic rather than be able to prevent it, just because there are so many different pathogens which could cause the next pandemic as well.
Any reporters with us today? Let's get to our community questions. And Janet has one for Zach. Zach, just how are you doing today, and what is your follow-up like?
My follow-up, I've gotten over every 3 months checkups, and now I'm going in every 6. It's not hard at all. The last follow-up I had, I actually caused a little drama in the CAT scan room because right after they gave me the what's the name of the fluid? I'm sorry, I'm drawing a blank.
Contrast?
Yes.
Yeah, okay.
After they gave me the contrast, I ended up sneezing 5 times in a row.
Gotcha.
So
what?
They were worried about that. And then right now, I'm just working as a mechanic and living day-to-day life, enjoying my time with my family.
That's all great news. Question, really, it's a statement from Ruth Ellen, and my daughter, she's 10, she just recently came home because they had the talk in school, in elementary school. We all remember that. But she says, health classes in our schools, it's such an important topic. Are they talking about that you know of, Dr. Holzberlein, or should they be?
So, no, I don't really think they're talking much about testicular cancer or exams. And unfortunately, actually, we've even volunteered sometime to go to the school, but haven't really been met with a lot of receptivity there. I think that, kind of going to Dr. Hawkinson's thing, public health in this country needs a lot more attention. And education, we have an opportunity to do a lot of education for public health in our schools. We don't do a very good job of that.
Jeremy wants to know, what is it that you're looking for with a self-exam? Just a lump? Is it easy to tell the difference when something's off?
So, not always easy to tell the difference, and there are different components of the testicle that can sometimes have lumps or bumps that are not abnormal. But again, what I tell my patients, no one knows your testicles better than you. And so if you're feeling something that's different or a change, that's time for you to see your doctor.
Okay, on that note, Colt wants to know, is it okay to ask my doctor for a testicular exam, just like your primary care provider? Or because somebody might, if you go to Dr. Wolf Birchfield and say, hey, can you do this? Because I don't want to test him. And you're going to go, wait a second. No, you have to go to a urologist or a specialist. Oh. Is that something that you could ask your doctor to do? Yeah. Or do you have to go to a specialist?
Well, I perform testis exams in my clinic because of the cancers that I treat. But I do think that's appropriate, just as as part of preventive care. Women's health exams are performed by primary care, so I do think that's appropriate.
Dr. Holzberlein, is that something men can ask their...
Yeah, I would take it one step further, particularly for young men. You should be receiving an exam, and it's concerning if you're not having a testicular exam. Almost all high school physicals still require a testicular exam for a variety of reasons, but one of those is sometimes we do pick up a testicular tumor. When I was a resident in training, oftentimes we would go to local high schools and do the testicular exam component of the physical examination.
So it's like baseline health.
It is baseline health, just like listening to the heart and lungs.
So Lynn wants to know, how quickly can testicular cancer spread?
So that's one of the, it's good and bad about the cancer. It's why it's highly curable, is that it's very sensitive to chemotherapy, but it is a rapidly growing tumor. We would say that a tumor, even in the testicle, could double in size within 1 to 2 weeks.
Tim wants to know, why the back pain or nipple tenderness with testicular cancer?
Yeah, sometimes this cancer, a very common pattern of spread is to involve lymph nodes in the back of the abdomen called the retroperitoneal lymph nodes. And so if they enlarge quickly, they can be painful. And also the kind of breast or nipple tenderness can happen. Sometimes these cancers make these chemicals that we call tumor markers, but they have these side effects that can lead to things like nipple tenderness as kind of, it's not that this cancer forms breast masses, but rather it's the side effect of a chemical that a hormone type chemical that the cancer can make.
Julia wants to know, if I feel a lump, could it be something other than cancer?
Absolutely, and in fact, most of them will not be cancers, likely. Most of them are fluid around the testicle or small nodules on the tube off the testicle, again called the epididymis. But obviously some of them are, and again, we don't necessarily recommend observing that. If you're just not sure, come in and see your physician.
But will those things that you mentioned go away on their own? Either lump is a lump and it needs to be seen?
A lump is a lump, it needs to be seen. They do not always go away.
All right, let's get to today's takeaway. And Zach, I want to start with you, and actually I have a question from Perry. Just how did you handle the emotional journey of getting diagnosed with cancer, and maybe what advice do you have for other folks? So maybe if you could answer that, and then just share what else you want us to know as we head out.
So when I first found out that it was cancer, I'm not going to lie, I cried right into my wife's lap. We got through it. It was definitely emotional because there was a lot of times that I wanted to quit and not continue. But I have my twin boys that I had to think about and powered through it and got it done.
Fantastic. We're so glad you're doing well. And we just, again, appreciate you talking about sometimes what can seem like a sensitive topic and just being a face for that. And hopefully somebody's watching today and recognizes the signs and calls their doc. So, Zach, thank you so much. Dr. Wolf Birchfield, today's takeaway.
For me, the takeaway is that while all cancers are more curable in early stages, testis cancer is curable even in a more advanced stage. And to just also continue to partner with your healthcare providers, with your primary care physician, in order to screen for cancer and to have open conversations about things changing with your health, because it's hard to know what that might mean.
Dr. Holzberlein, what's the takeaway?
Yeah, I'm gonna go back to being able to talk to your physician and public health and taking charge of your own health. So testicular examinations are a critical component of that, and being able to openly talk to your parents or openly talk to your spouse or partner, and then being able to share those concerns with your provider, your physician. And if you're not comfortable doing that, either figure out somebody else or get comfortable doing it, because it's a really critical component.
Yeah, that's what this talk is about, getting people more comfortable talking about it. Dr. Hawkinson, final takeaway today.
Yeah, I think it continues to be about preparation and prevention and doing all these things to help prepare for new issues, but also prevention and testing, and doing all that work on the front end will save you a lot on the back end as well.
All right, thank you to all of our guests today, and thanks to our viewers for being with us as always. We'll see you back here tomorrow at 8 for another Open Mics with Dr. Stites. Pregnancy and childbirth should be safe and joyful, but America has a maternal health problem. Black mothers in particular are at risk. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Meet an expert who has dedicated her life to keeping Black mothers and babies healthy, and how she's working to fix other disparities. Wednesday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.